We're going to go over now the S2 case study, and this is Jennifer. She's 27 years old, and she's overall healthy, and she had her first child 6 months ago, and her primary complaint is that she has low back pain toward the end of the day, and it's on the left side. Prior to having her baby, she did do aerobics and yoga about once per week. And she has not yet returned to any exercise after having her baby. So her goals are to eliminate low back pain, improve her posture, and to increase her energy, which I can totally understand after having a baby. That's such a great job, and we need to make sure that our moms have good posture and good energy so they feel energized and not tired all the time. So let's go through her assessment and figure out what kind of things that we're going to do for her to make her feel better. So in the half squat, she scored a 3, so that's great. She has actually her goal of wanting to improve her posture. She actually showed that she does have pretty good command of her posture in the half squat. So she had good range of motion, good leg alignment, and good torso alignment. As we go down into the full squat, she was only able to score a 2. So in that, the note to the side is that she had poor lower extremity alignment. So as she was going down and up, she was not able to maintain her knees and her feet all pointing forward as she was able to go down and up. So we could talk about that in alignment. It might be due to strength. It might just be due to she hasn't done something like this for a while. So the coordination of it, we would see an improvement in that. So as her first problem, we're going to write down that she has poor lower extremity alignment. I'm going to use the same abbreviations that I did for the S1 with the downward arrow, so decreased lower extremity alignment. Okay. On her goal heel raise, she was able to score a 3, so that means that her balance is good and she had very good command of her body posture over her legs. So a lot of times after women have babies, their core control is not good in terms of how they get their body after they've been in this position for a long time to get their rib cage back up on their pelvis. So that's great. I'm happy that she has a 3 on that, so that's good. The goalpost, she was unable to fully abduct her arms to get from a 2 to a 3. So common, and really common when women are nursing. So they're almost always in kind of a slouched position, and also just admiring their babies. It's lovely, but we need to work on that. So let's put down for her shoulder range of motion that she has decreased shoulder range of motion. And then on her leg flexibility test, she got 3s, which is great. So she has pretty good hamstring flexibility, inner thigh flexibility, and was able to sit in the Z-sit position with a vertical torso. So we don't need to write anything down for those. The next place where she got a 2 was on the roll-up. So on the roll-up, she had poor lumbar articulation. And on the 100, she had poor abdominal control. So as she was rolling up, her abdominal muscles were bulging forward as opposed to being drawn in. So let's write down for the roll-up, decreased lumbar spine, same abbreviation, LS, articulation, inflection. In the 100, we'll put poor core control for that, and that's definitely expected after coming back from having a baby. The abdominal wall was in such a different position for so long, so we'll work on her core control. Okay. Then for the side lift, the note next to that, she only scored a 1. She was unable to maintain shoulder organization. So in that, she was in the position, she could not get good alignment to lift when she lifted up into her side plank position, and also could not lift her arm and her leg. So we'll put up there that she has decreased shoulder stability And we can also guess that because she's already shown us that she didn't have good core control in terms of muscular control, that probably was part of the picture too. So we don't need to write it again, but we'll note that probably had to do with why she had a poor score on that. So decreased shoulder stability. Okay. All right, same thing in the push-up. So poor scapular stabilization, and she was sagging in her low back. So we've addressed both of those problems already. One was shoulder stability, one was core control. So she wasn't able to maintain the plank position. Again, totally understandable. The next one is the Superman. So she scored a 2 on the Superman, and she was unable to extend her hips or her spine. So again, we can guess because she doesn't have very good core control, maybe she wasn't able to control the position. So we are also going to write down, though, because we don't know for sure why, we're also going to write down that she had poor thoracic mobility and extension, and also poor hip extension for both of those, since those were both written down. So we have decreased thoracic spine extension, mobility, and decreased hip extension. All right. Then we get into her prone shoulder flexion, which was a 3, which is good. She was able to both lie with her arms overhead and lift and disengage from the floor. When we don't know why she was able to do that and wasn't able to do the full position for the goalpost, but maybe the support of the floor helped her develop enough core strength that she was able to lift her arms, where against the wall she didn't have that feedback from the floor. So we might guess that. So that's good that she had a 3 on that. The prone press up, she had a 2. And the note, and similar to the Superman, is she was hinging in the lumbar spine and she was unable to extend her thoracic spine. So that tells us that she had decreased core control and decreased thoracic spine extension, and we have those written already. And then she had prone knee bend of a 3, so that's great. She was able to hold her foot and disengage her thigh from the floor without any excess extension in her low back. Okay? So those are her problems. So now, what exercises are we going to choose to work on those as goals? So if we change the marker to decreased to increase, we're going to increase her lower extremity alignment, shoulder range of motion. We're going to improve her articulation in her lumbar spine into flexion, core control, shoulder stability, thoracic extension, and her hip extension. So those are our goals. Okay, so we just changed those arrows to up arrows. What exercises can we choose that will help with that?
Can I ask you something on the hip extension?
Sure.
So hip extension, your hamstrings, right, are your hip extensors. So could we consider, like, would it be looked at as decreased hamstring strength in order, like, she couldn't lift her leg? Or is it, do you look at it more from the front, like maybe she doesn't have hip extension because she's tight in her hip flexors? Like, do you try to get into that with when picking exercises, like what you think?
Yeah, we do. We do.
She's not tight in her hip flexors.
She's not tight in her quadricep. So I would say because
it's more of a strength thing.
Right, and we do want to look at that, and we don't always know. We don't always know why. You know, sometimes it can look similar, but because she was able to grab and lift her thigh, she's probably not overly tight. Even though we're looking at the quadricep there, we're still putting the hip into extension. Mm-hmm. She was able to do that without losing the position of her spine. So probably it's maybe a little bit more strength that we're looking at, to the ability to lift her leg from the floor. And we can think of that in the thoracic spine too. You have to have the mobility to be able to get into it, but that's the difference between the prone press up and the Superman. Superman, we're really looking at strength to be able to get up, but you're also going to look at mobility too, because if they lift you might see that they actually don't have the mobility to go into a lot of extension, so we'd want to work on her mobility. But if she can't lift at all, then there's probably some strength deficits there. Versus the prone press up, I get to use my arms. So there we're looking a little bit more at mobility. Although they're related, so we're gonna target both of those things with all the exercises anyway. Yeah. Okay.
Shelly, can you also talk about the glute being the primary hip extensor?
Yep.
And that when you lift your leg, that when the knee bends,
Then the hamstring that kicks in. Yep, yep, absolutely. So the clarification about the hip extensor coming from the glute, and especially when the knee is straight. So as the knee bends, we're going to start to kick in the hamstrings a little bit more, but the glute will be the one that is lifting off of the ground.
And how about maybe like the full squat, that she didn't have her lower extremity alignment because maybe she doesn't have the strength to hold her legs in that alignment as she's fully going down and up?
Maybe, we don't know. We don't know. And we'd have to do some very specific tests to see what was going on there. I would think it would be more like the lateral hip muscles that often allow the legs to collapse in. But yeah, it's a good, we can look at that, and we'd have to tease that out a little bit more. Yeah. All right. So what exercises are we going to give her to improve all of these things?
So you want to start from the top?
Sure. Well, we can start anywhere. Yep.
Footwork is always good for alignment of the legs,
Mhm.
the upper extremities.
Mm-hmm.
And butt work, gluteal strengthening, core control.
Okay. And what in terms of core control? So the answer was looking at footwork as one of the exercises that we would choose from her, which help her with her lower extremity alignment, and also core control. So how can we talk about core control in terms of lying flat on the reformer, where the reformer is supporting the body? What part of core control is important there?
So you have to maintain your neutral.
Right.
Especially with the arms or the legs or with the core.
Great.
You need to maintain control, so you have to use the local musculature.
Right. So looking at core control, remember we have core control in terms of the musculature system holding the body up. So when she scored poorly in the push-up and the side plank, we look at that as the strength of the muscles to hold. We also look at core control in terms of the relationship of the ribs to the pelvis and what effect either moving the legs and the arms has. So that's a great, easy way to start bringing an awareness to core control in terms of like the coordination of it. So that's good. So footwork. Okay. And are we reformer, or would you do footwork somewhere else for her?
Or maybe that's, I don't know about the trapeze table, maybe?
You could choose the trapeze table, because what's our criteria for choosing, one of the criteria for choosing it? Yeah, hamstring flexibility. And she had a 3 on her long set. So it'd be totally appropriate to do it as on the tower bar too. So in thinking of what if the reformer isn't free? Could I do it somewhere else? So we want to have reformer or trap tail? Either one is fine. Let's pick one. You pick.
Well, she's only 27, so we can challenge her. Maybe we could do the trapeze table.
Okay. All right, what's another exercise that is going to help address these goals that we have?
Bridging.
Okay.
Just to start to mobilize her lumbar spine.
Okay, and that would be good. And do you want to do that on the reformer, or could she do that somewhere else?
Well, she could do it on the mat. Unless you want, or you could take her onto the ladder barrel and do it so you get the thoracic mobility too.
Right, that would be a great thing to do. I love that. Yes, so you could definitely do bridging on the reformer, and as a warm-up and as a first thing to do, it would be great. But I would love to put her on the ladder barrel, because I think that would be it'd be really fun for her. Like you said, she's young. She wants to be challenged and get back to exercise. So bridging.
Maybe she could do bridges on the mat for home exercise.
Okay, good. So bridging on the ladder barrel and also on the mat for home exercise. Great. Okay. What are some other things? What about getting her looking at core control. What are some things we can pick up for core control for her?
Like as a woman, you could do like the dead bug exercises, just kind of feeling what it feels like to move one leg off the floor, and then if you know if that's okay, then you can go into some femur arcs or things like that, depending on how decreased her core control is.
Right, right. And she was able. Remember, she was. So she was able to do a 2 on the 100, which means that she didn't have total loss of control, but she had some loss of control. So I think that would be good for her to do. That would be fine, and it starts to challenge the trunk in a neutral position, which would be fine. And then we're also going to choose some core control exercises that put her into the position of the 100, because if we go back and we retest her, if we do all these exercises and we go back and retest her, I need to know that she's been doing things that prepare her to do the things that she wasn't able to do. So she wasn't able to do the 100 well. I want to make sure I put her in positions that are going to challenge that are going to teach her how to do it and then challenge it. You could do chest lift. Yes, I like that even better. Chest lift, and that's a mat exercise. Good, and that would be great for her to do at home.
I like the lateral flexion in the chair for shoulder stabilization, maybe?
Okay, so we haven't had that one yet in terms of this course, but we could do. So what have we had that would give her some lateral body movement and strength and coordination, as well as work on her shoulder, both her shoulder alignment and strength?
Well, this is lateral, but I was thinking like this supine arm series, just so she could start to feel the reformer, but you know, with like the arm, the shoulder flexion and things like that, just kind of feel you can get some feedback from the reformer and a little help coming up and down and adducting and things like that.
Okay, so we could do that, and that ties right into eventually teaching chest lift on the reformer, which would be the preparation for the 100. So just the curl up part. So hang on to that thought, Mira. We're gonna go into the side work. So look at what in the S2 material, where you have some lateral flexion that would probably be even more appropriate for her, since she's just a beginner.
I mean, there was a side kick, but it's not really, she has to stabilize her shoulder blade, but I know it's not really a stabilization exercise or.
It's a great stabilization exercise, absolutely. So the side kick, it's the same position that she's in more or less for the side lift, but much less demand on the body. So now you'd have the ability to get her into a better position, because all she has to do is support her rib cage. She doesn't have to support her whole torso. So I think side kick would be a great exercise. It's also really easy to modify, right? And she has pretty good hip and leg mobility, so we don't have to worry about a small range of motion. But if she didn't have very good balance, or if her core control wasn't so diminished that she couldn't do it, but her awareness wasn't very good, you can bend the bottom knee, you can change the length of the lever, so I think that would be great. I like that. I like side-oriented movement for her. So you said lateral flexion. What lateral flexion exercises did you have on the reformer? Mermaid. Mermaid on the reformer would be really easy for her to do. Cleopatra would probably be a little too involved for her at this point in a beginning level session, but she could very easily do mermaid, go into the side stretch and come back up. She got a 3 on her Z-sit, so we know we don't have to modify the sitting position. So I think that would be good. And again, you're going to look at both shoulder stability and shoulder mobility, because we're moving the arms overhead, both the working arm and the gesture arm. Okay, so that's on the reformer. Now, what are we missing?
You could do feet in straps or hip extension, and core control? Because like when you press straight down and, you know, starting to get the hamstrings to fire a little bit and feeling, you know, how low she can start to go so she can start to get some feedback about how her core control is. And also, if she couldn't do the 100 fully with her legs going down, so she can start to feel what that feels like to have her legs go down, but in
Great.
a supported
Good,
position.
good, okay. Feet and straps, that would be good. Is there another place? We've got a couple of reformer exercises, a few mat exercises. We're missing chair, just as a reminder, and we've only got one exercise on the trap table. So could we do trap table
We could do, yeah.
leg series?
The leg series,
Yeah,
yeah. We could do it.
So leg series on the trap table. Okay. So let's look for two things. One, what are we missing? What haven't we done yet? And let's see if we can bring in a chair exercise so that we know we're getting all of the pieces of apparatus in her session. So
Standing leg pump for posture and leg alignment.
okay, so standing leg pump, that would work. What else do we have? Because we've done some footwork. We've done a couple of things with footwork. It's totally fine. I think it's a great exercise for her. But let's see if we can find something that matches one of the goals and a chair exercise.
Like the scapula series on the chair, you know, make it like she can start to feel some feedback about retraction and what it feels like to go up and down.
Great. And what else can we do right along with that that addresses another one of her goals? Right. Right. So prone, scapular series, and the swan, both on the chair. Okay, so we have how many exercises? 1, 2, 3, 4, 5, 6, 7, 8, 9. Have we missed any of our? Let's start maybe making the pairings between that, and that might help us to find our 10th exercise for her program. Okay, so lower extremity alignment is going to go into which exercises? Which are going to address lower extremity alignment? Okay, footwork. What else?
Some of the leg series on the trap table too.
Okay, so leg series. What else?
It's sidekick maybe too, right? She can't
Sure.
be all over
Yeah,
the-
she has to keep a parallel position or turned out depending on the variation. All right.
I mean, and this is kind of pushing it, but bridging, I mean, you don't want her knees to go out.
Definitely, definitely. Yeah, it's going to give her an awareness of that in a deep bend position, which was one of her problems. She couldn't do a full squat with good alignment. So this is like a full squat in a different orientation, different position to gravity. All right. Good. What about shoulder range of motion?
Supine arm series.
Okay, supine arm series. I feel like I should use another color just so we can see. All right, so shoulder range of motion, we've got supine arm series.
Mermaid will give us a range of motion.
Sure, absolutely, and mermaid. All right.
And, I mean, this, never mind, it's a different swan. I was thinking the swan on the floor gives you some range of motion, but that's not what we're doing. That's not what this exercise is.
No, but you could think that for the future would be able to address that, and that would be great. All right, so flexibility through our lumbar spine in flexion.
Bridging.
Okay. Could you use chest lift if we allowed the lumbar spine to be in a more lengthened position, not in neutral, but in a more lengthened position, because that's similar to the position she wasn't able to do in the 100, but she doesn't have to support her legs. So I would use chest lift both for thoracic mobility, even though we're looking at extension, she still has to roll up and roll back, but it's also going to help her get into a lengthened lumbar spine It's little thinking out of the box, but it's definitely going to help her because it's the position of the 100 without all the demand. So the legs aren't going and you're not holding for a long period of time, and the hands can help. So I would use chest lift as that as well. Okay. All right. Next. Core control.
Almost all of them.
Okay. Okay, so let's think of it in terms of what she couldn't do. So for core control for her, it was the 100. If we just kind of make a note under here, it was the 100 and the side lift and push up. And also we can maybe, again, think about the connection between her doing the 100 with the abdominal bulge and the inability to lengthen, right? So, and that goes along with, the roll-up goes along with the 100. So both of those.
It's actually a
Okay.
well, chest lift, so you have to
Okay.
do your core.
Good.
And the leg series too. That's especially on the trap table. It's a lot of core control.
Great, because it's a much more moving and dynamic situation for her. Great, and that's why I really like that. For somebody when they're first starting out, feet and straps on the reformer is fantastic. But leg series on the trap table, it's just a little more interesting. So if you have somebody young and who's pretty fit and she's done yoga before and things, I think it's a good choice.
With the hamstring, she might need some more strength, and I think that's a little bit more. It's hard. It's like harder muscularly wise. You really have to move sometimes. Like this, you can kind of. It feels nice.
Right.
Like that's a little more intense, like strength-wise on the Cadillac.
Well, and you don't have the help of, if she, a lot of times people will have one side that's a little bit more, a little stronger than the other side, or they just tend to use and favor one side more. We don't know that about her, but might happen in real life. And it's very independent. On the reformer, you can cheat a little bit. On the trap table, each leg is responsible for doing the movement, and that's the exact movement she needs of hip extension to be able to score better on the Superman next time. Right? Next time we do the test. Okay. What about core control? If we think about the side lift or the push-up, right? We've got side kick for her, and if we think of core control with the relationship of the ribs to the pelvis. So you have the mermaid. It's very easy on mermaid to have a position that starts to look like this, right? Or rounded. So coordination-wise, that's important. And also the same thing for the swan. It's very easy on the swan, even though you're lying on a surface that's supporting you. The farther forward you go, the more you have to manage that sense of core control. And it's a plank position, but it's really supported. So that ties back into her not being able to do a push-up very well. That's a similar orientation to the movement for her. So that might be a good choice. Okay. Shoulder stability.
Side kick.
Okay.
Mermaid too.
Mm-hmm.
Prone.
Mm-hmm.
And also the swan, right? Because don't you have to keep your arms extended when you come up?
Right, and you have to maintain the position of the shoulder blade. So I kind of put those together, but I'll draw a separate line. And what about the supine arm series? There's a certain amount of stability there that she's going to need to have. Right. But it is she's moving through space with less assistance and less feedback as opposed to being in weight bearing and against something that's not moving. But she also has the support of the carriage behind her shoulder blade, so that helps sometimes. Makes it a little bit easier, okay? All right, thoracic extension mobility. Have the swan, and we're going up into the bridging on the ladder barrel, which I love. That's a great one.
What about if you did mermaid with the extension variation?
Great, yeah, you could definitely do that. Yeah, so I would make sure I write that next to it, is with extension. So in writing the name of it, I would put with extension variation. something like that, so that we know when we're looking at your homework or we're looking at your exam, you mean that one. The same thing with flexion. If you were doing something with rotation and flexion, just make sure you jot it down, and that would be great. Okay, hip extension.
So like side kick. A little bit, side kick, a little bit of extension?
There is extension and side kick. And
The leg series?
leg series, great.
No, what about bridging? Because you use your.
Because you're having to push up. Absolutely. And there's another part too.
I mean, maybe footwork too, but it's probably not as much as.
Not. Oh man. So bridging. What about doing prone scapular series and swan without any support for the legs? Right, so you're having to hold the legs up against gravity. So that's also going to work that. All right, so now let's put these exercises in the order that we want to teach them in the session. Great, yeah. So you want to limit the number of equipment changes, and especially in the beginning. There's times in the middle you may only do a couple of exercises one place and then you'll change, but in the very beginning it's really important to set that flow and not be moving around too much. All right, so we have supine leg series and footwork. So I would start, if we're starting with our supine lower extremity work, I would start with those two exercises on the trap table. They go together and they are on the same piece of apparatus and they fulfill the first category of supine lower extremity integration. If we think of the kinetic chain spectrum, closed chain to open chain, the springs really make it like mostly an open chain exercise. You're getting a little bit of feedback. It's not completely open chain, but it's closer to open than it is to closed. With the tower bar, because it's on the fixed arc, and because there's a pretty decent amount of spring tension that you're going to press against, it's going to be more like closed. So in getting better alignment, and we know that she had some challenges with alignment, it's going to be better for her on the tower bar first and then move to do the leg spring series. If she didn't have good flexibility, I'd be worried about teaching her there first, but she has great flexibility. So we just are going to teach her, just like we would in footwork on the reformer, how she's going to align her body, how she's going to move, and I think that would be fine. Yep. But you can definitely, and the trap table is a great place, intersperse mat work into it, because you don't have to change to another piece of apparatus. So that's a great way to do that. And you can do that on the reformer too. Sometimes without leaving the reformer, you can do some mat exercises. So supine leg series, okay? And I'm just going to put a T over here so that we know that we're on the trap table. All right? So you could stay on the trap table and do chest lift after she does her leg work in both places, and just stay there and introduce the chest lift. Or you could bring her to the reformer and do her arm work, which might be nice to get some range of motion before she puts her arms back behind her head. And then do chest lift, could be on the reformer. And again, then you're limiting the number of times that she's changing positions. Because it's a great place to teach chest lift, because they're going to go right into, eventually in the progression, they're going to go into the 100. So let's do, as a reformer exercise, our next exercise, the supine arm series. And then chest lift, which is mat, but we're going to do it on the reformer. Okay. Now, which of your mat exercises do you want to give for her for home exercise? So we have bridging on the mat, bridging or chest lift on the mat, and side kick. Which for her do you think are going to be the most valuable for home exercise?
Bridging and chest lift.
Bridging and chest lift. Okay. They're kind of similar.
Yeah, bridging and.
I would choose side kick and something. I would probably choose chest lift, because I like that as core control exercise, and it gives her some spinal mobility work, which is important for her. And you can teach her. We don't always want to reinforce a position that somebody's in, and we can guess that she's in this position because she was doing all her nursing and holding and everything, for the first, couple years is very forward oriented with a baby. You can guess that it's not very well coordinated flexion. So it might be a great opportunity to teach her how to flex without collapsing. So that might be another benefit that we didn't really look at as a true goal, but it's going to definitely be a benefit for her. So I would say probably I would do chest lift and side kick. So we'll put those, we'll make that note at the end. All right, so what's our next exercise? Okay, so we have weight bearing through mermaid and through side kick. We have spine extension and some weight bearing with prone scapular series and swan. And we have seated with the mermaid. Okay, so which of those, so we've done footwork and leg work, we've done arm work and spinal mobility and deflection. Where would you like to go?
Well, if you're still on the reformer, would you maybe go into mermaid first? Maybe mobilize a part of her upper thoracic without actually putting her into extension yet?
Maybe.
While you're on the reformer?
Sure. That'd be a great use of stay on the same equipment. And she's already done some arm work. Now we can get into both seated and upper extremity weight bearing. I think that's great. Okay, and that's also on the reformer. So we've done mermaid. We can look at going into the chair, the prone scapular series and the swan. I would like to do those. I think I would like to do those next. Good with that? Okay. One of the ways, so we've got prone scapular series and swan. So we're looking at shoulder stability, scapular stability, and we're looking at spinal extension, and we've got the assistance of the springs on the chair, which is really helpful. Plus, we decided to do it without the boxes or table. So she's also working on her hip extensor strength. Now we have side kick, we have bridging on the ladder barrel, and we are missing standing, right. So we don't have a standing exercise. So what do you think would be the most helpful for her for standing exercise? So we've got things like scooter and standing hip stretch, and we've got the standing leg pump on the chair with the different directions. What do you think would be your choice for her?
Scooter would be nice.
So we're going to put that in at the very end. So that's going to be our 10th exercise. And I'm going to choose to not have her do bridging as a home exercise, because we decided we would do side kick. So we'll just take that out so it's not confusing. And we're going to do scooter on the reformer as her standing exercise. And I think that's great. And that's on the reformer there. So now, which would you like to do next? So we've done some lateral work, we've done prone work, we've got side kick, and we've got bridging on the ladder barrel. Which of those, if we're thinking now we're moving into full body integration, which one is going to be a little bit, probably a little stronger for her, that she's going to have to work a little bit harder?
Side kick to me is harder.
Yeah, side kick has more activity in it. Side kick is going to be a little bit more active, where at bridging it's active, but we're working on the relaxation part of eccentrically lengthening the front of the body to get into that deep hip squat position and then to come back up. So working on lower extremity alignment, hip mobility, and spine mobility, and core control. So which of those do you feel like would come better after doing the prone work on the chair? So I would probably do side kick now. It's similar. She's just done some shoulder work, so now we're going to turn on to her side and do side kick. Now, what might make you want to change that is if she was really fatigued or tired, or she had done so much of this that we needed to give her a break, and then bridging would definitely do that. And you could put either one there, and that would be fine. So we're going to do mat which could also be on the trap table if that's close by. Side kick. Ladder barrel. Bridging. All right, and we've got our 10 exercises. Okay, so we have, if we're thinking about all the different components, we have 10 exercises, so that's checked off. We've used every piece of apparatus, that's checked off. We've managed it in a way that she's not changing. She's going through and making as few equipment changes as possible. We've done we have a exercise in each one of the sequences in the categories. Great, good job. We're going to continue now with Jennifer and do her intermediate program. So we did the beginning program, and one of the students has submitted this as an intermediate program, and we're going to take a look at it and see how all of the criteria are met. Number of exercises, equipment, goals, all of those things for the intermediate program. So all the exercises, we have footwork on the reformer, breathing on the trap table, side lying leg series on the trap table, and these are just in a random order right now. We're going to put them in the order that we want. Mermaid on the chair, sitting on top of the chair, roll down reach on the spine corrector, supine abdominal series on the reformer, lateral flexion on the chair, mat scarecrow, push through and circumduction on the trapeze table with the tower bar, and ladder barrel back to forward bend. So that's the start of her intermediate program. So what I'd like to see right away, two things jump out at me, that we only have 10 exercises, which is okay, but let's do 12. Let's have some more exercises on there. And we only have one mat exercise right now, and we need to have at least 2 in her program so that she can have 2 home exercises. All right, so how do you guys feel about this for the selection of exercises, keeping in mind her goals and the exercises that we did in the beginning program? We can definitely add the 100, and that is good because it ties back into the screening. So we're giving her something she wasn't able to do before and hoping that she now is progressing through it, and that's going to be a marker. We're going to know if our program is successful, if the screening scores would increase. So let's do that. Okay, and then let's pick another exercise, so we have 12, and then we'll put them in the order that we want. So we have quite a bit of arm and torso work from breathing and the mermaid, the lateral flexion, scarecrow, push through with the circumduction. Let's add one more to this. Is there anything that looks like we need to just have a little bit more? We've got a lot of arm and shoulder work, body work. Standing? Standing, okay. So we've got scooter, standing hip stretch. I'm going to put standing hip stretch because that's a nice one for her to do with flexibility. And it's also going to put her at times in a position where she's in a similar plank, not with the same arms and legs away from center, but it is going to give her that same orientation. So let's do reformer. Standing hip, whoop, stretch. All right, so let's start to put these in order using the categories. So now we know we have 12 exercises. So footwork on the reformer. Supine lower extremity organization, absolutely, so that can stay as number 1. Now as we start to think the next exercise, you want to think of either another supine lower extremity or supine upper extremity, and you also want to remember if you can get another exercise on the same piece of apparatus. So sometimes you might not be able to, but let's see if we have another supine reformer exercise. Right, so we can do the supine abdominal series, which includes supine arm work and abdominal work. So we've got spine articulation, and we're on the same piece of apparatus. So I think that would be a good one. So this will be number 2. Okay, and let's say that we're going to add in maybe the coordination exercise for her. So of that, we've got roll up, we've got just plain roll up, we've got roll up into the 100 position, the actual 100, and we've got coordination. So I think for her, it's kind of a fun, challenging, but very doable exercise. So I'm going to write coordination in under here so we remember that that's one of the variations we want to make sure that we include. Okay? So now, where can we go? So we've got supine upper and lower extremity. Where could we go that either stays within that same category or goes on? So there's no more reformer. Right, so we've got trapeze table, breathing, and side-lying leg series. Which of those would you like to do next? So we've just done supine abdominal series.
So we can change position to go to the side?
Okay, we go to the side. And then, is there another exercise that we could, if we think of breathing and supine abdominal series as pretty close to one another, we're lifting the bottom or we're lifting the top. In terms of intensity, which one of those is more challenging? Between breathing and supine abdominals.
I mean, personally, I think the abdominal series because you're lifting your...
Right. So if we weren't thinking about switching equipment, I would probably do the breathing exercise first of those because it's more supportive. I'm working my arms, but my legs are supported, and I'm doing bridging where I'm lifting my bottom instead of unsupported legs and upper body curling up against gravity and the weight of the springs. So is there another exercise that we might be able to put in here instead of the breathing exercise? I like the breathing exercise for her, but I feel like we're going more challenging, less challenging.
Maybe sort of bridging on the reformer, and you could add in the leg extensions or something like that.
Great, I like that. I like that. So we could maybe stay on the reformer and do some bridging because we know she needs to work on hip extension, get the strength of maintaining the hips lifted in the bridge, plus she does get to work on her articulation. So I love that. That's great. So let's just make a quick substitution here.
So would we consider that a lower extremity integration?
Because she's still using her legs. She's still supine, and it includes some articulation, just like the arm series would with the roll-up. All right, so we've got reformer, bridging, and we're going to do with the press. I'll just abbreviate it as press, but with the press out, however much she can do. So she might be able to get her legs almost all the way extended. She might only do a partial one, and we'll see how she does with that. So let's do number 3, and then we can go over to the trap table for the side-lying leg series. Okay, so does it make sense to continue on, stay on the trap table, maybe do one of the mat exercises or maybe the seated push through? Does that feel like it flows okay? So 100 is similar to what she's done already. So she's done some of the roll-up, so she's prepared for that. I'd say she's probably not prepared enough yet for the scarecrow. So I'd like to leave maybe scarecrow to a little bit later. But the push-through might be nice too. If we think of the push-through, sometimes it's helpful to have something to press against to go into the flexed position. And getting a little bit more flexibility through the thoracic spine. So that might be nice for her to do next. Plus starting to open up the chest, but we can also do the 100. So I think it'd be nice just to roll her over. She's been doing the side-lying work. Let's go right over and do the 100. So we're on number 5. And then let's go up to seated push through and circumduction, which is 6, which falls into the category right now for her as seated work, seated upper extremity integration. So do we want to end with the standing hip stretch or back to forward bend? So back to forward bend, standing in front of the barrel. going back, coming up through the standing position, doing the standing roll down, and then coming back
That's an
up.
extension.
That is an extension. And it also qualifies, it has the components of full body integration. She's moving head, neck, shoulders, arms, spine. She's doing a standing roll down, so she has to manage her leg position. So this will be 12.
So maybe the scarecrow should be an exercise program.
It is part of her home exercise program,
Okay.
definitely. Yes, definitely. And then we'll put back to forward bend. So what else? We have chair, both mermaid and lateral flexion, and then scarecrow. So where would scarecrow fit in? We don't have another mat or trap table exercise, so this is one of those where we're just going to do what we're doing, go and do it, and then come back, and that's okay. So I would maybe do we've done the roll down reach, is maybe go into the scarecrow from there and continue with that. That follows on in the same theme of extension. But I'd like her to do scarecrow. I think she can do it now. We're into our intermediate program, so I like it. I want to keep it in there. So our choices are to do roll down reach, which is going to prepare her for the extension part of it with the arm reach, and then go into scarecrow now, and then we can go up and start doing some of the lateral flexion work with the mermaid and the lateral flexion on the chair. Okay? So that leaves us at number 8, I believe.
Because she needs to review her exercise program anyway. We have to see how she's doing it.
Right. Well, and at this point, this is where we're teaching. We're probably now at this point just teaching her these. This is going to be her first attempt at them. So she's had some of the other exercises from her beginning program, and now we're teaching these
That's new.
as they're going to be new exercises. Okay. So then we've got mermaid and lateral flexion. How would you choose the two of those? I think she needs to have more challenge. Because she's young and wants to increase her energy and wants to do all those things. I think let's just give it to her without. So I would do the mermaid first, because that gives us an opportunity to look at a lot of different things that are going to be present in lateral flexion. What I'd watch is how many repetitions you do, because if you do a lot of repetitions of this, then you have to go and do almost the same thing. People start to get tired. So, and you talked about leaving the hip down or leaving the hip up. You can choose to lift the hip up, which is going to give her a much more elongated stretch. And then if you wanted more core control and more upper thoracic mobility, you could do it with the hip down. Now she has to manage more things as she's moving. The hip up version is going to give her more of a stretch. Might be a little easier for her to find really good shoulder alignment. Because remember, a lot of people, when they do the mermaid on the chair sitting, either with the lunge, the side lunge position, but both sit bones down, or even both legs on top, either bent or straight. For some people, they're lacking in mobility so much that they can't even get their hand to the pedal. So that's one of those times where the pedal height really makes a big difference. So starting with that, it's like, whew, there it is down there. Can't get to it. So the hip up version, until somebody either understands how to do it or has the range of motion, is a nice way to warm that up. And that way she just can start to get an awareness of her shoulder organization or alignment, and then quickly put that into the lateral flexion, see if she can maintain it now while she's having to maintain the balance of her body. Okay, does that make sense? All right. So 8, 9, 10, 11, 12. So we have, if we think of all of our different filters, we have 12 exercises, which is an appropriate number for the intermediate session. Have we done something in every one of the categories? Do we have spine extension, upper extremity weight bearing? We have seated. We have standing and full body integration, supine at the beginning. So I think that looks good. We have something on every piece of apparatus. Great, because we also have a spine character and a ladder barrel, so that's really good. That's a good different program for her. Have we spoken to all of her goals? Are there any goals that we don't have an exercise for. So we're working lower extremity alignment in both footwork and bridging and side-lying leg work. Probably somewhere else we can, the standing hip stretch, and a little bit even on the back to forward bend, because we can, if her alignment is off, she can easily see it too. That's a nice thing about the roll down. Shoulder range of motion. Okay, we have roll down reach, supine abdominal series, mermaid. Okay, great. Do we have some lumbar articulation and deflection, bridging, seated push through? Yeah, so,
Roll down the edge.
yeah, because she has to go through that. She has to go through that position. Good. Core control, several different things, especially getting into lateral flexion, because she has to manage herself on top of the chair. The scarecrow for developing enough core strength that she can go into extension and lift her arms, so that's quite good. And that even though the legs are not going to lift, that still can contribute positively to helping her with her hip extension, because she still has to stabilize a bit, not lift, but that's a good one for her. It also starts to address some thoracic extension mobility. It's again not one that you would choose in the beginning, right? It's not going to help them in the very beginning. You need to mobilize first, but that's gonna be a good one for her. Shoulder stability. Mermaid, lateral flexion, and even to a point, some parts of the push through. Right? As I'm going into the push through, I've gone back to the lean, and now I have to roll forward. There's a certain amount of stability there, and a certain amount of stability as I'm opening, so I'm not doing any strange shoulder things there. All right, good. Have we done anything with her posture? A lot, good. Hopefully her low back pain is decreasing because she's moving better. She's moving more symmetrically, and she's a little bit stronger, so she has more mobility and more strength. And some of these exercises are quite zippy. Yeah, they're interesting. They're fun, and she's going to have to think about them, and hopefully that's going to help her with her energy too. All right, anything else?
You know, it's just like a coordinated.
Yeah, she has a few things in here that are gonna probably pique her curiosity a little bit. It's like, ooh, how do I do that? Oh, the coordination. How do I manage the breathing and the arms and the leg opening and stay up and do all those things? Push through the circumduction. People love because it just feels really good. In addition to, oh, I have to think about how I'm going to do this. Good. Okay. Very nice. Anything else? Great. All right. So that's Jennifer and her intermediate program.